2 months before the expected rollout of universal health coverage, which is currently under pilot phase in 4 counties, has been earmarked for a countrywide rollout by the Ministry of Health. Health Cabinet Secretary Cicely Kariuki says financial challenges have been the greatest impediment to the attainment of UHC.
We have learned that it is important to utilize a financing mechanism that delivers efficiency and also ensures the pooling of health risks and thus containment of health costs and reduction of inequity across health services.
It is for this reason that the CS disclosed plans to introduce yet another health financing scheme as proposed by health experts so as to make the universal health coverage program a success.
Ministry of Health will immediately initiate implementation of the proposed recommendations while ensuring continued engagement with county governments as well as public and private providers and indeed the citizens of this country who stand to reap a great dividend in improved access to healthcare services.
The task force says the unemployed population, which translates to 75% of the Kenyan population, will be eligible for the scheme that seeks to avail medical services at zero cost.
People as well as people who are in informal sector, people who are not employed, we have created a scheme into which we should be run by NHIF on behalf of the government.
In the program, the government will be forced to dig deeper into its accounts in order to finance the scheme.
Money, the funding of that scheme will primarily come from allocation of tax from the national government. Yeah. And what that will mean is that all the service providers, both public and private, will be able to provide services as long as they have met the accreditation requirements, and number 2, as long as they agree to the rates that NHIF will be offering, which rates will actually have been determined actuarially and determined by an independent body, not necessarily NHIF, so that way we can separate those roles.
In November last year, the Ministry of Health introduced UHC cards that would enable Kenyans in the pilot counties to access quality and timely public healthcare services before the official launch of UHC pilot program in 4 counties in December same year. Universal health coverage is part of President Uhuru Kenyatta's Big 4 agenda and aims to adopt a primary healthcare approach that will entail scaling up immunization services, maternal and child health services including family planning, skilled delivery and antenatal and postnatal care services. Purity Museo, Channel 1 News.